Hello, I'm Dr. Scott Bolger, a physical therapist from Core Rehab Physical Therapy with locations in Keller, Justin, and Bedford. I'd like to take the time today to discuss the benefits of stretching for the breast cancer community and to review when it's appropriate to initiate a stretching program. We'll then go over which stretches are the most effective and how to perform them. If you've ever been involved in any of the following procedures, including surgical breast biopsy, lymph node removal, lumpectomy, mastectomy, breast reconstruction, or radiation treatment, then you can definitely benefit from stretching to improve movement in your shoulder and arm, including reducing shoulder and chest pain, stiffness, and post-procedural swelling. The first step in initiating a stretching program is to check with your physical therapist, surgeon, oncologist, or physician to inform them that you'd like to initiate a stretching program. This is especially important if you're only several days or weeks out of completing a procedure or surgery, as there could be sutures or drains to consider and that may need to be removed prior to initiating a stretching program, and to also allow for tissue healing. After reconstructive breast surgery, you may be also asked to avoid reaching your hand above shoulder height or reaching behind your back. Following lifting restrictions, usually 5 to 10 pounds at most. Avoid any pushing or pulling activities, such as opening a door with the affected arm, vacuuming, or pushing yourself up out of bed. Please remember that these are basic guidelines, and be sure to check with your surgeon or oncologist for specific post-surgical instructions. The bottom line is, do not initiate a stretching program on your own without first consulting a healthcare professional. In addition to initiating a stretching program, you also need to know when to stop stretching and inform your healthcare provider of a change of symptoms, such as finding that you're getting weaker or experiencing more pain, tightness, or tingling in the chest and arm that has been increasing. You could also be experiencing new heaviness, numbness, aching, or other strange sensation in the arm or chest. Increase in redness or heat of the breast, or a change in breast shape, including experiencing headaches, dizziness, blurred vision, or shortness of breath. It may also include experiencing unusual swelling that may get worse. But this could be symptomatic of lymphedema, and Dr. Steve Bjorn from Core Rehab will cover this in his upcoming lymphedema video. However, fluid may also collect near the wound, known as a seroma, and may need to be drained by a physician. Now that I've covered the precautions, let's move forward to help improve your shoulder and hand active movements. The most important aspect of stretching is that you take your time and not be in a hurry. It can take up to several weeks to experience an improvement in range of motion, so be sure to slowly build up your tolerance to the stretches and don't push through pain with any of them. You have to allow your body time to heal, so it's important not to race through a stretching program. Also note the importance of stretching over time, especially those of you who have experienced radiation treatments, as the skin, fascia, and muscle can develop scar tissue for a long time after treatment has been completed. Keep in mind that a physical therapist can also assist with freeing up scar tissue to help you improve your shoulder and arm range of motion. People who generally want to know how often to stretch and how many reps, your goal is to perform up to 7 to 10 repetitions at least 2 to 3 times per day. You also want to be able to hold each stretch for 10 to 15 seconds, but you can also use 3 to 5 breaths that are deep to accomplish this as well. You want to start at a light intensity and increase the intensity when you're ready. You want to focus on gentle, low tension, prolonged stretches with no bouncing or rapid, jerky movements. There's no straining to achieve the movement either. Remember that muscles stretch more easily when they're warm, so you can stretch mid-morning after you've been moving around a little bit and perform some light shoulder home activities. Another good time to stretch is in the early evening, about 1 to 2 hours before dinner. A simple initial activity to stretch the shoulders is during walking by just swinging your arms. If it's too painful, then just leave your arm by your side until you're ready to swing it. And hopefully you experience less pain with that. Walking is also a good way to easily warm up the shoulder for other types of more advanced stretching. As you progress with basic stretches, consider functional home activities that can improve your shoulder range of motion, such as brushing or combing your hair overhead, or slowly reaching up behind your back just to touch under the shoulder blades, like fastening a bra, or reaching up into a cupboard to place or grab a dish. The important focus with either stretching or functional household activities is that we take the shoulder joint to its end range in a pain-free movement to help improve or maintain the best range possible for your shoulder. Let's take a specific look at some stretches that can help accomplish this. A good precursor to stretching the shoulder complex area is just working the trunk. You notice I'm starting from the left and then from the right. Nice, gentle, easy stretching. It's a good way to work the obliques, the lumbar and thoracic musculature. And again, a good way to start warming up when you're getting ready to stretch the shoulders, to stretch the musculature below it, which provides some additional support to the surrounding areas. A good warm-up to stretching the shoulder complex is to work the neck. You may find that after surgery or radiation, you can experience tightness across the shoulder chest area, which also affects the lower neck. If the front of the neck is tight, then the muscles in the back of the neck have to overcompensate to be able to perform a movement such as looking up overhead, and you can experience possible headaches as a result. So it's important to get all aspects of the neck in all the different planes of motion. Again, as you see, I'm doing nice, gentle ranges of motion, not going too fast, and it's important just to take your time with it. And you'll see as I start to arc here, I'm only doing a half semicircle. I'm not doing a full complete circle. So I'll do half of the back, half of the front, but not completing a whole one, as it affects the joints a little bit differently, and I feel that it's easier just doing half movements. As we're getting into shoulder ranges of motion, you'll see me doing very, very tiny circles, again to your tolerance, and then as you improve, you can increase the arc as tolerated. Just be sure to go to your own tolerance and not push into any kind of pain or larger arcs than you need to. These are the pendulum stretches. You'll see me moving forward to back, side to side, and clockwise and counterclockwise movements. It's a very good what we call anti-gravity position. The arm is going straight down into the ground, and you're just having to rock back and forth using your hips and your body movements to help accomplish this. This is good after post-operative surgeries with just gentle, light stretching and not having to move the arm up against gravity. Again, you want to rock your body and use your hips and trunk to help accomplish the movement rather than just your shoulder. Simple exercise to promote circulation throughout the arm. Let's say that I've had my right shoulder and chest worked on. Now I'm just performing elbow flexion and extension. I'll be opening and closing the hand. This is mostly to get circulation throughout the arm without impacting the shoulder or chest area if it's too painful or uncomfortable. Here's another basic exercise involving the shoulder complex, but also the trunk again. It's a good way, leaning to the side, opening up the obliques in the lumbar and thoracic musculature. Again, if you notice, I haven't had surgery here, so I'm able to accomplish the full movement. Again, you may only be able to bring the arm up halfway or hardly at all, but it's a good way just to stretch the trunk if you can. So don't worry so much about the shoulder, but more of the trunk movements, moving side to side, and again, comfortably. Here's a stretch that works on shoulder flexion, or being able to raise your arm overhead. Just sliding the arm forward. I'm on the side of the table, so I'm able to reach my chest further down below the surface of the table. If you find that it's not good enough stretch, then you can slide the chair back a little bit, and then you can get a little bit deeper into that stretch. Again, you're just going to go to tolerance and only as far as you can comfortably, and not stretching through pain, but up to it. We're now progressing from a seated table slide to a standing slide up the side of the wall. It's a more advanced way to improve shoulder flexion for those overhead reaching movements. If you find that it's a bit difficult, you can also use your hand to do a spider walk, walking up the wall, as you'll see here. Some people find it easier to have the fingers help out if you're having difficulty raising it on your own. Here's another way to perform the same movement, now with a foam roller. Rolling up and down the wall rather than sliding your hand up the wall Some people find it a little more comfortable to use a foam roller. These are called snow angels. You just want to reach up overhead as high as you can comfortably. You'll notice I'll be doing one that isn't as high, just to show you that you can just do it to your tolerance. Another thing is the back. I'm arching my back slightly here to show you what not to do, because people have reported getting muscle spasms in the mid and low back because they're straining. So make sure you're flat in your back as well by adjusting the knee position. Call this exercise hands behind the head. You want to focus on bringing the elbows down as far as they can, having a nice hold, and then returning to the original position. This is good for working any type of activity like brushing your hair, washing your hair, and reaching up overhead. This exercise is used to perform reaching behind the back movements. You'll just take a towel or a strap, hold onto it with the affected hand, and use the other hand to bring it around the hip and hold it. I usually prefer 10 to 15 second holds to perform the activity. If you're able to reach behind the back well, then you can alternatively bring the towel up over your shoulder to improve the range of motion even further, as demonstrated here. You don't want to overdo this movement or push through it into pain, and again, to your tolerance. Here's an important stretch, especially if you've had surgery. This is to stretch the pectoral region. It's called a doorway stretch. If you notice I'm just turning away, you'll feel a stretch going all the way across the chest. This is really good at opening up your arm movements, and you'll find that you'll feel it again across the shoulder, chest, and maybe even down into the bicep. You can also alter the angle. You can put your arm higher up. You can put it lower, although with the lower you'll find I get too much range of motion, and the more effective stretches are horizontal and 45 degrees up, as I'm showing you here. Again, a really effective stretch to open up the arm range of motion. This is one of my favorite stretches using doorway pulleys. You can get these pulleys on Amazon for about $15 to $20, and it's a really good way to have an assist to stretch the shoulder. For example, I'm stretching the left shoulder and pulling down with the right hand. With the shoulder, you can go out at different angles. So I can go straight ahead, or I can go at a 45 degree, or all the way out to the side. And it's a really good way to be able to slowly and steadily stretch your arm. Just slow down the pace. I'm doing it kind of quickly here, but enjoy it. Try it for about 4 to 5 minutes, and it's really good, effective shoulder flexion stretch. Another way to improve overhead movements, you'll see here I've attached a weight to a PVC bar. This helps with shoulder flexion again. I'm using the weight to help pull the bar down. If you notice, you take up the initial tension, allow the arms to relax, and then the weight will take it down just a bit further. So you really want to feel that letting go and that melting of the muscle. This applies to every stretch that we've done here today. Is taking the tension up, allowing it to relax, and going further into that stretch. And that's what's going to be the most effective. You'll see I adjust my knees here in case I'm arching my back to avoid any thoracic or lumbar muscle spasms. So similar to the doorway stretch that we did prior, this is called an open book stretch, where you're lying on your side. I want you to notice as I'm opening up my shoulders and arms that I'm stretching that pectoral muscle, but note how I'm taking up the full tension, relaxing, allowing that muscle to melt, and then going a little bit further. Again, I can't emphasize that enough to be able to really improve your stretching by allowing that shoulder movement to take tension, relax, and then go just a little bit further, and again into a comfortable position, nothing painful. Like the doorway stretch, this is a really good one, and if you'll notice my arms going further and further each time. But again, do it to your tolerance, and a lot of patients enjoy this opening up stretch. This exercise is similar to the open book, only I've added a 1 pound weight. You can use a can of soup at home. Some people find that it really helps bring the arm down and enhances the stretch. So again, this is similar to the doorway stretch and the open book stretch. This here called scapular circles or scapular clocks. You'll see me doing a clockwise motion and then a counterclockwise movement. Notice how when I go to the back, I'm not able to get a full circle. It's because of the shape of the shoulder joint. You're not going to be able to get a full arc all the way around as much as you'd like. So take that into account. Don't worry about it. It's just the tightness of the muscle and the shape of the capsule that's going to dictate your movements. And like all the exercises we've done today, as you can see, some of these are a little bit more aggressive, and you really want to make sure you check with a healthcare provider before starting any of these. Again, you don't want to do these if you're fresh out of surgery. Make sure you know the protocols, the precautions, and work with a healthcare team before initiating any of these. And now we're back. Thank you so much for watching the video, and hopefully you find the stretches to be beneficial and helpful throughout your daily lives. I've seen a lot of people benefit from these, so I really hope you can too. And as always, if you have any further questions or you need additional information, feel free to check out our core rehab physical therapy website at ptwithadifference.com. Thank you so much.